and welcome back to another episode of the Health Talks. I'm Dr. Shahid Mohammed Abulanain and I'm the host of the podcast. As part of Women's Health Month, today we're talking about a topic that many women experience yet often feel uncomfortable to discuss it openly, which is urological health. From urinary tract infections to conditions like incontinence, these are issues that can affect daily life yet are often overlooked or delayed when it comes to seeking care. And that's why we're here today. We're here to break the silence, raise awareness, and make this conversation a little easier. I'm joined by Dr. Zahra Jahanabadi, specialist female and functional urologist at Thumbay University Hospital in Ajman. Welcome, Dr. Zahra, and thank you very much for being here today.
Thank you. I'm so happy to be here. And I'm very happy to be part of the team at Thumbay University Hospital.
We're very happy to welcome you here today.
Thank you. Welcome.
Dr. Zahra, let's start from your experience and knowledge as well. What are the most common conditions, urological conditions, that women face today?
Yes, there are some urological problems that are very common between women. These include different types of urinary incontinence, pelvic floor disorders, and including pelvic floor, pelvic organ prolapses, overactive bladder, and urinary tract infections. These problems are very common between women, but all of them are treatable.
Right. Doctor, you touched on urinary tract infections. These are usually issues women face frequently. How often do women actually should normally experience urinary tract infections, and why do they develop that often for women?
Yes, urinary tract infections is very common in women at all ages.
Right.
There is some symptoms such as frequency, burning sensation during urination, painful gross hematuria, and sometimes lower abdominal discomforts. Urinary tract infections are very common because of some points in the urethral anatomy. The urethra in women are shorter, and because of its bacteria can reach bladder more easily. And there are some other risk factors such as low fluid intake, holding urine for a long time, chronic constipation, low genitourinary hygiene. And because of it, there are some risk factors for urinary tract infections, and urinary tract infections are very common.
Right. So there is an anatomical risk factor,
yes,
and then there is an environmental risk factor.
Yes.
So how can women reverse the risk, for example, and how can they prevent urinary tract infections from occurring?
Yes, there are some key points that women should know about that. The most important things that good hydration,
right,
and enough fluid and water intake. Another one is a good hygiene in the genitourinary system, manage any type of constipation, and sometimes some other problems about the hygiene of the genitourinary tract, some points about the types of underwear, and these topics are very important for preventing urinary tract infection. But the most important thing is good hydration.
Right. So good hydration and hygiene are very important to prevent
Yes.
from urinary tract infections.
Yes.
Thank you very much for highlighting that, Dr. Zahra. You've also touched on incontinence and prolapse. Are these conditions age-related? Do they specifically affect women of an older age group, or can they affect women of any age?
About urinary tract infection or about urinary incontinence?
About incontinence and prolapse. Are they
Yes.
restricted to a specific age group?
Yes, about the urinary incontinence, all types of urinary incontinence and pelvic floor disorder and pelvic organ prolapses, these symptoms, these problems are not age limited. But although these problems are more common in the postmenopause women or after childbirth, but this problem can occur in young women too. Sometimes in some women without any history of normal vaginal delivery. Yes, and so because these symptoms and these problems are not age related, awareness is very important at all stages of life.
Right. You've shed light on a very important thing, which is awareness, and that's why we're speaking about this, so women of all age group are informed. And to also increase their awareness, can you tell us what are the symptoms that they should never ignore and seek urological help immediately?
Yes, there are some symptoms, some urologic symptoms that are important, and if any person faced with these symptoms should go for urologic consultation. Some symptoms such as frequency in urination, any burn sensation during urination, urgency, urge incontinence. Urge incontinence means that before a person reach to washroom, cannot reach to washroom before leakage.
Oh, so cannot hold
urine. Yes. And stress urinary incontinence means any leakage after cough, laugh, or any exercise, any type of blood in urine, painless or painful, not different. Any blood in urine is very important. And another symptoms is any pelvic pain or pressure sensation in the pelvic area, or any sensation of pressure or bulging in the vaginal and pelvic area. All of these symptoms are important and should be evaluated as soon as possible.
Thank you very much for highlighting it, Dr. Zahra. You've mentioned frequency. Usually people drink water and then they use the toilet every 30 minutes to an hour. When does frequency become actually concerning and it needs to be checked?
In the text, the frequency on the going washroom more than 8 times a day is important and is may need to more investigations. But each patient should know that if any change in the urinary frequency is needed for any evaluation. So for example, if you, before 1 week ago you usually go to washroom 4 or 5 times during the day, and if any change in this schedule is happened, it's not normal. Yes, this change is not normal. About what was the second question?
The frequency. When does it become concerning?
Yes. And one point is that waking up during night sleep for urination is not normal. It's not normal. Only one time may be normal, and any waking up many times during the night is not normal, or having a feeling of constant urgency is not normal. Any urge incontinence, any stress urinary incontinence, these are not normal and should not be ignored.
Right, so it's a very good thing that you're highlighting to observe yourself and observe your body. So see what's normal for you and observe yourself. If anything is deviating from what you're used to, then that should be an alarming sign.
Yes, sometimes some symptoms may be an alarming sign. In urology, in women, or in all people, any frequency, any long-standing symptoms such as frequency, dysuria, urgency are not normal. And one important thing is that these symptoms may be an alarming sign or an early sign and symptoms of more serious problems,
Right.
such as bladder cancers. And it's very important, and these symptoms, any symptoms if persist, should be evaluated as soon as possible.
Right. And Dr. Zahra, a woman has these symptoms, for example, some of these symptoms, they come to the clinic. They're worried about the evaluation process. Can you tell us how does it look like from your experience?
Yes. Our evaluation usually begins with a complete history taking about the duration of problem, about the any risk factor, and about any problem that the patient wants to say us. And some history about family history, past medical history, surgical history, and any medication. After a complete history, the second step is a complete physical examination. Physical examination is done in a comfortable and safe environment. In physical exam, in urological physical exam, vaginal and pelvic physical exam is very important. Then, according to the information from the history and physical exam, we decide if any another or further evaluation is needed or not. So our evaluation is stepwise and individualized.
Right. Thank you very much for outlining it, Dr. Zahra. That definitely gives reassurance to our listeners. What are the tests that are usually done to rule out certain conditions or reach a definitive diagnosis?
Yes. At the first step, the first test is a simple urine analysis.
Right.
Simple urine analysis can give us some information about the any urinary tract infection, microscopic hematuria, or any abnormal cell in the urine. In the patient with any suspicious to urinary tract infection, we request urine culture too. Another test is sonography of the kidney and the bladder, which revealed very good information about the intra-abdominal and intra-pelvic content, any stone, any abnormality, any lesion, and it's a very good, safe and informative test for us, and it's very non-invasive test.
Right.
Without any radiation. Sonography is not any radiation. Another test is uroflowmetry. Uroflowmetry is a non-invasive, simple and easy test for patients. And it has some information about the pattern of the urination and how bladder empties urine, and some information about the bladder capacity, and it's a very good and informative test for our decision. There are more complex tests such as other radiologic imaging, such as CT scan, voiding cystourethrogram, retrograde urethrogram, urodynamic study, and cystoscopy.
Right. You've outlined it very clearly and shared lots of information with us, Dr. Zahra. That's definitely enlightening. It puts you into perspective and reassures you definitely. So it's a non-invasive, easy process that does not require any invasive procedures, nothing to worry about. So the woman can actually reach a diagnosis and peace of mind immediately.
Yes. Most tests are very easy and painless.
Right.
Yes, such as urinalysis, urine culture, uroflowmetry, and ultrasonography are completely painless. Yes. But about some more complex tests, some patients may feel a mild discomfort about the test, but usually these tests are well tolerated by the patients.
That's great.
Yes, and we provide a safe and a comfortable environment during doing these tests for all patients.
Amazing. And now tell us about the treatment options for the common urological conditions.
Yes. For the common urological conditions, we have a different management, such as for urinary incontinence and pelvic floor disorder and pelvic organ prolapses. We have some management from some conservative management, such as lifestyle change, pelvic floor rehabilitation and pelvic floor exercise, bladder training, some medical therapy, and finally for some patients, different surgical treatments. For the patient with overactive bladder, we have some conservative treatments such as lifestyle change, pelvic floor rehabilitation and exercise, neuromodulation, and in some patients, some surgical treatments such as intravesical Botox injection. For other problems such as urinary tract infection, we have some medical antibiotic therapy and the advices about the lifestyle change. And in this area, we try to have a good conversation with the patient about education, about some lifestyle change for prevention the future episodes of urinary tract infection, which is very important.
Definitely, prevention is the key to successful treatment.
Yes, yes, yes.
So the treatment is very structured and professionally and properly outlined, let's say. It's common practice.
Yes, yes, yes.
So nothing to worry about.
Yes, exactly.
So does treatment always involve surgery or not necessarily?
No, no. In most situations, the
cancer
was in about urinary incontinence and prolapse, especially stress urinary incontinence. About the stress urinary incontinence and pelvic organ prolapses, in most instances, with some conservative and medical management, many patients can respond to these types of management, and only when there is not a good response to medical and conservative management, we can move toward any surgical treatments.
Right. Dr. Zahra, can you also outline what are the lifestyle changes that women can adopt to prevent prolapse, for example, and urinary incontinence?
Yes. The most important thing for prevention urinary incontinence and pelvic organ prolapse is some changes in the lifestyle. The first important thing is beginning pelvic floor exercise from young age in all women. It is very, very important. Other things are control weight, control blood sugar, and some other exercise are important and good and helpful. But other than some exercises such as yoga, fitness are very good and important. But the most important thing is pelvic floor exercise.
These pelvic floor exercises include the Kegel exercises.
Kegel exercises, yes,
Great.
yes.
Are there some mistakes, for example, that women make that unintentionally increase the risk of urological conditions?
Yes, there are many mistakes about this. Some of mistakes are have not good hydration during day, holding urine for a few times, for a long time holding urine, improper hygiene in the genitourinary tract, inappropriate use of antibiotic without medical guidance.
Right.
These are very, or having a chronic constipation. These are some mistakes for women that's prone the women to many urological problems.
Right, thank you very much for highlighting them, because they're easy fixes. They're things that you can unintentionally do, but you can definitely adopt a healthier option.
Yes,
Thank you, Dr.
yes.
Zahra.
Yes, here you are.
You work at Thumbay University Hospital, one of the leading hospitals in the country. What are the facilities that you can offer women with urological conditions or concerns?
Yes, at Thumbay University Hospital, we provide a comprehensive and individualized care for all urological problems in women. And this is consists of some conservative, medical, and all surgical management in this manner. And all services are in a high quality at Thumbay University Hospital.
That's definitely reassuring. So from the diagnostic aspect as well, up until treatment.
Yes, yes. From diagnostic to treatment, we have all tests, all lab tests, urinalysis, urine culture, uroflowmetry, ultrasonography, all types of radiologic imaging, ultrasonography, CT scan, and we are planning to introduce urodynamic studies soon.
That's amazing. Thank you very much for highlighting that, Dr. Zahra. That gives reassurance to all our listeners that treatment is easy, diagnosis is easy. It just needs your approach to seek help when needed.
Here you are.
Thank you very much for enlightening us, Dr. Zahra. It was a lovely and enriching conversation, and I'm sure it will be of so much benefit to many women.
Yes. I would like to, finally, I would like to women that they are not alone. And there is no need to feel embarrassed about their symptoms.
Right.
Because with medical advancement and with these high quality facilities at Thumbay University Hospital, we can offer them a complete package for treatment and management of any urological problems. We are here to help them to improve quality of life and to feel better and better during in everyday life living.
Thank you very much for this kind message, Dr. Zahra.
Thank you.
And thank you very much to our listeners for seeing us and listening to us till the end. See you in the next episode.